Hi everyone, my name is Grace. Today I'm going to be presenting a systematic review that was published in 2025 by Anna Batalla, Isabella Marcoux, Emilia Main, and Gabriella Gysi. It's titled Barriers to Physical Activity in Women from Ethnic Minority Groups. The paper was published in BMC Women's Health, which is a well-regarded open access journal with a impact factor of 3.3. My goal today is to summarize what the researchers found, why it matters, and what it tells us about improving health equity for women. So, going into the introduction, we know that physical activity offers major health benefits for everyone, but also including women. Some of the benefits can include reducing the risk of heart disease, diabetes, and mental health illnesses. But still, globally, women are still less active than men. For women from ethnic minority backgrounds, the gap between men and women's physical activities is even bigger. So, cultural, social, and or environmental factors often restrict their ability to engage in exercise. The purpose of the study was to identify and synthesize existing research that has found these barriers across countries and cultures that prevent women from participating in physical activity. This was a systematic review, which means the authors followed PRISMA guidelines to search for and analyze all relevant studies. They searched five major databases, which included Medline, PsycInfo, um, Embase, CINAHL, and the Web of Science. Eligible studies did focus on adult women from ethnic minority groups, excluding African American and Indigenous women, who have been covered in other literature. I did want to note that. Um, the Prisma flow chart included 64 studies in total and used the mixed methods tool to assess quality. I did um, include the flow chart. So we can see that out of 23,000 records, 64 met all the criteria and were included in the final analysis. But I did want to note that of these 64 studies, we are representing 5,500 women from across 12 countries. Some of the results that were seen across all the studies, the authors identified 16 main barriers, which are grouped into the four levels of the social ecological model, which I did include on the next slide. But at the individual level, women reported lack of time, fatigue, low motivation, or health problems, which was a barrier to physical activity. At the interpersonal level, family responsibilities, cultural expectations, and limited spouse support were major issues. It did note, like a pretty big note, that some women said that their husbands preferred that they stay home rather than go and participate in physical activity, which I thought was interesting. Some of the environmental barriers included unsafe neighborhoods, lack of women only gyms, poor transportation, and limited access to parks or facilities. And at the societal level, systemic issues like poverty, discrimination, and restrictive immigration policies played a major role on physical activity. So overall, these barriers operate on many levels and they do reinforce each other. Here is the chart for the social ecological status for physical activity, some of the barriers that they found. But I did also want to talk about when the authors compared barriers across world regions, they did find some patterns. In America, time and family responsibilities were the biggest issues. In the Eastern Mediterranean, they had cultural norms and misconceptions about exercise that were key in why women didn't participate in it. In Southeast Asia, there were gender expectations dominant there. Um, And then in Europe, there were safety concerns and misconceptions about physical activity that were common. So, although each region has unique themes, cultural and gender norms are consistent everywhere. So, to summarize this up a little bit, the barriers to physical activity among ethnic minority women are multi level and they are deeply interconnected. Cultural and gender norms appear across all contexts, limiting women's freedom to exercise. Structural inequalities, such as low income, discrimination, and lack of support, make some of these barriers even harder to overcome for women. So, this means that promoting physical activity to women isn't enough. At an individual level, it's not about encouraging these women to go exercise, but it requires changes at the community and policy levels in some places as well. Some of the strengths of this article included its broad global scope, its rigorous methods, and its clear framework for organizing results. A few of the limitations are that most of the studies were qualitative and relied on self reports from the women. It also is a weakness that African American and Indigenous women were excluded. So the findings can't represent all groups. The authors did emphasize several directions for future research. First, there's a need for more intervention studies, not just identifying barriers, but to test what actually works to overcome them. So, for example, studies could evaluate community based or culturally tailored exercise programs that address the family and social expectations. Second, future research could include underrepresented regions such as Africa and the Middle East, where women's physical activity is still not really studied. There is also a need for quantitative research to complement the qualitative findings, which measures how strongly each type of barrier affects women's participation. And then the last future research that is researchers should explore how the acculturation and migration experiences influence physical activity over time, such as like how long-term residency in a new country might change attitudes or opportunities for exercise. So overall, the study does highlight that physical activity is not just a personal choice. It's shaped by culture, environment, and inequality. The authors did address that we should be tailoring these interventions to women in the places that they live and not just encouraging women as a whole to be more physically active. And I do agree that addressing these barriers um, will require collaboration between health professionals, community leaders, and policymakers in some places. But I do think that if these people are able to know the benefits of physical activity, if they see the benefits that it has on women's mental health as well as a family as a whole, I don't think that addressing these barriers um, will be super problematic. I think that it will be helpful for women in the future.